Hello viewers, today we are going to talk about the circle of Willis. Now if you have never heard of the term circle of Willis, you can at least understand from the name that it is a circle and it is named after someone called Willis. So who is this Willis person? This is someone called Thomas Willis, who was from the 17th century and is an Englishman who has made notable contributions to the world of medicine, including, as the name suggests, circle of Willis, as well as coming up with the numbering system for the cranial nerves and adding the term mellitus to the disease diabetes mellitus, signifying the honey smell of urine in diabetes mellitus patients. In some medical exams in India, the picture of a scientist is shown and they need to be identified. So this is the picture of Thomas Willis, a very prominent person in the world of medicine. His contributions remain relevant even 400 years after his birth. So with that history lesson out of the way, let's talk about the circle of Willis. It is basically a collateral circulation of arteries responsible for blood supply to the brain. Now the entire arterial blood supply to the brain is not provided by the circle of Willis, but the circle of Willis plays a very important role in the arterial blood supply of the brain. We'll get to it a little bit later. But first we need to understand which are the two main arteries supplying arterial blood to the brain. The two main arteries supplying arterial blood to the brain are the internal carotid artery and the vertebro-basilar artery. Now I like to talk about arteries by tracing their origin from the heart itself, because all arterial blood is pumped out of the heart and all venous blood returns to the heart. Now let's talk about internal carotid artery first. Internal carotid artery on both sides arises from the common carotid artery on both sides. The common carotid artery on the left side is a direct branch of the arch of the aorta, which of course is a continuation of the aorta, and the internal carotid artery on the right side is a branch of the right common carotid artery. Right common carotid artery is a branch of the brachiocephalic trunk, which in turn is a branch from the arch of the aorta. Brachiocephalic trunk, as the name suggests, is responsible for providing arterial blood to the upper limb and the head and neck region. Now let's talk about the internal carotid artery in more detail. Internal carotid artery is formed by the bifurcation of the common carotid artery, usually at the level of fourth cervical vertebra in the neck. So internal carotid artery forms in the neck. This part of the internal carotid artery is known as the cervical part of the internal carotid artery, and the term carotid itself means to stupefy in ancient Greek, because if you press on the carotid arteries of both sides, a person can lose consciousness. Cervical part of internal carotid artery gives out no branches. Internal carotid artery enters the brain through the carotid canal. The carotid canal is part of the petrous part of the temporal bone, so this part of the internal carotid artery is known as the petrous part of the internal carotid artery. Once the internal carotid artery exits the carotid canal, it lies in the cavernous sinus, the only instance in the human body where an artery lies inside a vein. Once the internal carotid artery leaves the cavernous sinus, where it is known as the cavernous part of the internal carotid artery, once the internal carotid artery exits the cavernous sinus, it becomes the cerebral part of the internal carotid artery. And the cerebral part of the internal carotid artery gives out 5 important branches, starting with ophthalmic artery, which, as the name suggests, goes to the orbit and gives out many important branches, the most important clinically being the central artery of retina, which if occluded due to diabetes mellitus can lead to blindness or visual difficulties. After the ophthalmic artery, the other 4 branches of internal carotid artery are anterior cerebral artery, anterior communicating artery, middle cerebral artery, and posterior communicating artery. So important thing to remember here is posterior cerebral artery is not a branch of internal carotid artery. Internal carotid artery gives out 5 branches: ophthalmic artery, anterior cerebral artery, anterior communicating artery, middle cerebral artery, and posterior communicating artery. Now let's look at the other important arterial system of the brain, the vertebro-basilar artery. Now there are 2 vertebral arteries. Vertebral arteries arise from the subclavian artery. Subclavian artery on the left side is a direct branch of the arch of the aorta. On the right side, subclavian artery is a branch of the brachiocephalic trunk. Brachiocephalic trunk, as I said, is a branch of the arch of the aorta. So subclavian artery gives out the vertebral artery, and vertebral artery on both sides ascends through the transverse foramina of the cervical vertebra to enter the skull through the foramen magnum. Now, vertebral arteries give out two branches which join to form the anterior spinal artery, and the vertebral artery also gives a branch called the posterior-inferior cerebellar artery. Two vertebral arteries join to form the basilar artery. Basilar artery gives a branch called the antero-inferior cerebellar artery. It gives out many pontine branches. It also gives a superior cerebellar artery, and it gives a big branch on each side known as the posterior cerebral artery. So posterior cerebral artery is a branch of the basilar artery. Now, interesting thing to remember here is the cerebellum has a superior cerebellar artery and two inferior cerebellar arteries, antero-inferior cerebellar artery and posterior-inferior cerebellar artery. To make matters worse, antero-inferior cerebellar artery is a branch of the basilar artery, and the posterior-inferior cerebellar artery is a branch of the vertebral artery. Now let's look at what are the components of the circle of Willis. Circle of Willis is basically a collateral circulation, as I said, between the internal carotid artery system and the vertebro-basilar artery system. So what it does is it joins the two. And what is that link? The link is the posterior communicating artery, which joins the internal carotid artery to the posterior cerebral artery. Posterior cerebral artery, as I said, is a branch of the basilar artery. Now let's look at the components with the help of this diagram. So this here is the internal carotid artery, the cerebral part. This small branch here is the ophthalmic artery. This continues as the middle cerebral artery here horizontally, and towards the top of the picture, the upper half of the picture, these two arteries on each side are the anterior cerebral arteries, and they communicate with each other with the help of the anterior communicating artery. And this artery lying below is the posterior communicating artery, which is joining the internal carotid artery with the posterior cerebral artery. Which territories are supplied by each of these arteries? We'll just talk about three main arteries: anterior cerebral artery, middle cerebral artery, and posterior cerebral artery. Anterior cerebral artery is largely responsible for the medial aspect of the cerebral hemispheres. Middle cerebral artery is responsible for the lateral aspect of the cerebral hemispheres, as shaded in pink here, except the superior part of the frontal lobe and the inferior part of the temporal lobe. The posterior cerebral artery is largely responsible for the occipital lobe and the posterior-medial aspect of the cerebral hemispheres, and as well as the inferior part of the temporal lobe. Now, what is the utility of the circle of Willis? If there is a block in the arterial circulation anywhere in the circle of Willis, another alternative path can be established for arterial blood to supply that part of the brain, which would have otherwise been deprived of arterial blood. However, ischemic stroke is a reality, and that only happens when the blood clots or obstruction to the arterial blood happen at an area beyond the circle of Willis, that is, the areas where the arteries have become end arteries. So I hope you liked the video on circle of Willis. Thank you for watching this. Take care, bye bye, and please don't forget to be awesome.